Okay, good afternoon, everyone. Thank you so much for taking the time on a busy Thursday afternoon. I always say this, but it's so important to us, for yourself, right? We want to make sure we're learning, we're strategizing, and walking away with some new nuggets so we can make more sales and create some lead generation and traffic to our Insure Me Now direct site, to our website, right, to your social media pages. And that's what today is about. So, as you know, we are primarily a life and annuity IMO with over 22,000 agents now in every state in the U.S., almost every city in the U.S., as a matter of fact, which is awesome. Um, we have agents that focus on estate planning, right? They love the 10 to over $100 million IUL sale, whole life sale, whatever it is. And we have agents that are health insurance agents that you focus on Medicare, Medicaid, supplementary products, which is also great. And then they cross sell and they come in with the right hook with life insurance. So my point is, we have a little something for everyone. And everyone, and when you think about this, generally speaking, they're looking for the big fish, right? The case where they're making 50, 60, $70,000 of commissions, which is wonderful. And obviously, we love those types of cases, and we have the carriers to support those cases. But the issue is the typical consumer, the typical insured for those kinds of cases, or small business or large business, they're few and far between. So the point is, over 22,000 agents, you need to get the word out. You need to open doors. You need to build relationships, right? Create, let's say, social media ads, posts, right? Whatever it is, blogs, even articles. And you have to open the door where someone says, Bill, you know what? Critical illness sounds great. It's only a few bucks a month. It's guaranteed issue or instant issue, right? Tell me more. That's your chance to jump in, even though it's not your $70,000 commission case. It's okay because you're opening the door, right? You're asking questions, fact finding, and then you may be able to pivot to the $10 million term case or IUL sale, whatever it is. So this carrier, these products are great for door openers. And I always suggest you start small, right? And you put this piece or this video out there. You start driving traffic, and it doesn't matter, if you've been doing this for a year or 52 years, doesn't make a difference. You need to generate the sizzle, and that's where Surebridge, United Healthcare comes in, because I feel like they have mastered this part of the industry when it comes to small term, critical illness, cancer, dental vision, accident. They are the leaders, and they're also on Insure Me Now Direct. And think about this for a minute. So Insure Me Now Direct, right? These are all the products and carriers on your website. Think of Amazon, right, for life insurance and supplemental products. You can just drive traffic to your Insure Me Now Direct page. These consumers can go on your site, 2 a.m., run a quote, purchase the product. You woke up in the morning and boom, you have a new sale. And now a new client you can set an appointment with to pick up the phone. And that's when you ask about life insurance, right? And other products, long-term care, whatever, disability even, right? That doesn't make a difference, but you have to create the sizzle first. So important. Now, and you think about door openers and creating sizzle. Everything on Insure Me Now Direct comes with a 1-year free scholarship with Sage. Okay, we even have a self-enroll button for your client. So that's all built in for free, and it's free for you, the agent. But think about driving traffic, right? How do I create more consumers, build my book, right? Speak to more people. So when you talk about your message, right? And I think this is so important. You can literally hold up your cell phone tonight when you get home, have your spouse, whatever, hold the phone for you, set up a tripod, and talk about different concepts, different stories. And when you think about a statistic like the one I'm going to tell you right now, think about the consumer on the other side saying, you know what? This guy's got a point. Tell me more. Okay. Boom. That's your new lead that you just generated for free. okay, through YouTube or Facebook or whatever social media site you want to use, okay? No brainer. 2022, so last year, okay, and this is a fact, 1.9 million new cancer cases were diagnosed in the United States. 1.9 people were diagnosed with cancer last year, in 1 year, 12 months, okay, in the US. Once you have a story like this, a fact, a statistic like this, okay, that's going to open doors. People are going to say, you know what? If the breadwinner in this household was diagnosed with cancer, okay, what's going to happen to these three little kids or to his spouse or her spouse? Okay, think about that, right? No brainer. Tell me more. There's a policy that can protect against this, okay, that will pay a lump sum benefit if the insured is diagnosed with cancer, heart attack, stroke. Oh, think about this. No brainer. And again, now you're building a book. Now you're building relationships. So remember that statistic, because what I want you to do is when we're done, I want you to go Google heart attack, cancer, stroke, right? And start creating these messages, these articles, these stories, and share this on your social media outlets to all of your consumers, to your book of business, right? Doesn't make a difference. You got to get the word out to everyone so they know you are the guru. In fact, what I did is I pulled the top performing social media posts when it comes to critical illness, accident, okay? And I'm going to share those with you at the end just to give you some great examples of what you can use. I always say, don't reinvent the wheel, create a few more spokes in the wheel, okay? Very important stuff. Okay, what we're going to do, we're going to have our contest at the end. Whoever answers first and correctly wins. We have the Apple AirPods and a copy of Tim Grover's Relentless book. And the Relentless book is amazing. That's Michael Jordan, Kobe Bryant's former life coach. And what his whole topic is, his strategy is getting your mindset right, okay? Being in the right place every day. That's what it's about, maximizing your effort and maximizing your personal and business life. Very important, because I feel like you can have the best leads in the world, the best products and commissions in the world. If your head isn't in the right place, the consumers feel that. They see that. Okay, it's a negative energy. Nobody wants to be around those people. So it starts with yourself in your head, period. So that's why I love all that motivational stuff. Okay, some of it, yes, is rah-rah. Tim Grover stuff, I personally love. I think you will also love. He was the feature. We had a recorded message at our expo by Tim Grover, and he also promised to be the keynote at next year's event. So very excited about that. Let's keep moving forward here. These are recent testimonials here at Levinson and Associates. I love sharing this stuff. I love seeing this stuff. And every agent that shares a testimonial comment gets a copy of our IUL prospecting book, or I'll even give you Relentless if I have enough in stock. We're running a little low, but definitely share your thoughts on our Facebook or Google review page. Top left-hand corner, Robert, we finally got this policy placed. Charisma was most helpful. Thanks for your help. Tell Josh I appreciate his efforts. That means the world, Monica. Thank you for taking the time. On the bottom, check this one out. Working with Levinson is like hitting the lottery. It can't get any better than this. Bryce, love it. Adriana, great company, excellent advisors, best customer service ever. Okay, we take this very serious. Okay, and even though 99% of the time we have great reviews and feedback, okay, for that 1% time where we might make a mistake, me, Carrie, my father, we're going to jump in and we're going to do what we can to make it right. We answer the phone if there's a problem. You can email us, whatever works better, and we're going to try to turn the situation into a plus, okay? If it's out of our control with a carrier, we'll try to leverage our relationships and go to bat for you. Okay, let's keep moving forward. This is huge. iPipeline, the biggest technology vendor in our industry by far, okay, by far. So we were the first to partner with iPipeline, okay, and Amplify years ago, and we developed the first electronic application, period. We were the pilot agency for them, and I'll never forget it because the insurance carriers said we were crazy. They said there's no way a client is going to fill out a electronic application and share their personal info on a computer never going to happen. They'd rather fill out 47 pages of paper in front of them. And look what happened today, especially with COVID, right? Pushing this whole electronic thing fast forward changed the world. Well, the same thing is happening now with electronic policy delivery. And this was a case study that iPipeline just launched. And basically, what it shows, they picked us again as a pilot agency, showing how electronic policy delivery is saving so much time, not only for you, also the consumer. You're getting paid on the average of 1 to 3 weeks faster with traditional insurance carriers. So very proud of this. We'll include the article in today's thank you email that every attendee will receive. Next slide. We're very, very serious about this. Okay. We're very proud of this. Our team has done a fantastic job putting together our brand new Levinson and Associates website page. And let me tell you, Beth, Michelle, my hat goes off to them because we've been working on this for 3 to 5 months now. And I think you're going to love it. If you haven't seen it yet, check it out, levinsonandassociates.com. It's more streamlined. We have a search bar function now. Everything is much more user-friendly. We even have top right corner. That's the new scorecard. So what's so cool about this, you can go in at any time. It's updated real-time fashion. All of your cases are in front of you. And then you can compare yourself against other agents, right? All reporting to Levinson. You can also check out your entire downlines production. You can say, hey, Shirley, Johnny, I noticed you haven't submitted an application in a week. What's going on, right? It gives you a pulse on all of your downlines business 24/7. So definitely check out the scorecard. Let's keep moving forward. The new playbook's out now as well. So we have so many agents that come to Levinson and they say, I love what you guys are doing, but I'm so overwhelmed. I don't know where to start. I don't know where to end. I don't know what's what. I don't know who's who. Well, if we can go to the next slide here, you're going to see our Levinson menu. Think of a restaurant. You sit down for dinner and you don't know what's on the menu for appetizers, right? Desserts, after dinner drinks, entrees, whatever it is. Okay. We broke it down into 3 easy to read and understand menus. Okay. Left side is marketing. Okay. We call this the marketing playbook. Middle section, new business. The right section, contracting and commissions. So that's everything that we offer here at Levinson in a nutshell. Very easy to use and understand. And then, let's say, for example, on the playbook, right, we have over 50 different marketing options and sales platforms. If you click on any number, it will give you the explanation and then jump into more details if you want to move forward. So it makes it very, very easy to use and understand. Let's keep moving forward. And then I'm going to introduce our featured speaker today. Jorge, our regional vice president, is joining us in just one more slide here, 1 more minute. And he's going to jump in with the actual presentation of the day. So real fast, what's new at Levinson? And by the way, I always say, right, you don't have to sit here and listen to me and our team. Watch what we do. The proof is in the pudding, okay? You're going to notice our new website, our new mobile app, our social media pages, our reviews page, right? We're always pushing the needle when it comes to technology, agent feedback, products, carriers, always bringing out the latest and greatest to our agents. You need to do the same thing for your consumers, okay? And what I think of first is Positive Tuesday, okay? I came up with this whole Positive Tuesday thing. What does it mean? Absolutely nothing, okay? It's a quote. It's a positive quote that I come up with every week with a cute little picture, and then we post it on all of our social media sites, okay? And yeah, I get a lot of people that say, Bill, I love what you're doing. A few people say, oh my gosh, this has changed my life. I look forward to these quotes, blah, blah, blah. Wonderful, okay? And that makes me feel great inside because it's about giving back, right? But at the end of the day, it's marketing, and you all need to do the same type of thing. I'm not saying Positive Tuesday, but come out with Long-Term Care Wednesday, right? IUL Tuesday, Ancillary Products Friday, Critical Illness Thursday, whatever it is. Come up with a quote. Come up with a graphic, a 1-minute video. Get your YouTube channel up and running. This is all free. Okay, so for you not to run with this and market and brand yourself is ludicrous. Okay? Watch what we do. Watch what we do. Okay, real fast. This is what's new. And if you don't see anything on here, we're riding a horse in reverse around New York City in 2023, which shouldn't be happening. Okay, so this slide always has to be current and updated, and we have to come out with new stuff to help our agents, period. So, top left corner, a surety was just added to Insure Me Now Direct. We have some great contests going on. Just under that, we have the Jimmy Buffett's Margaritaville Cruise leaving out of South Florida. So we are paying for 4 nights, 5 days if you hit your minimum annuity production. Baltimore Life is our newest carrier. We just added to our core carrier list. So if you're interested, let us know. On the right hand side, we have our annuity alert. That's our hottest, greatest, latest annuity rates. Every single Monday, we send those out. If you're interested, just let us know. We'll add you to the annuity database list. And then let's keep moving along here. So training is all about our weekly webinars, which is what you're on now. The Bill Levinson Experience podcast is another great training resource. The new playbooks we just spoke about. And then, of course, Carrie's Corner, Volume 27. That's his personal editorial. Think of it like a blog, and he shares some great sales stories from the old MetLife days that I think a lot of agents can learn from, these tools, these great resources. So run with this stuff. It's all on the website. Next up, I want to introduce our featured speaker of the day. We have Jorge on from Surebridge UHC. Jorge, you there, bud?
I am here. I was on mute there. Sorry about that. And
No
let me
problem.
go ahead and show you my screen so we can get started. I think you're looking at it now, but Bill, great
Yes.
introduction, great information. Something you touched upon, which I touch upon a lot, is cross-selling. And cross-selling is huge in our industry. And you're exactly right. You know, you can start off with a very small policy that's going to open the door with a new client and very easily get in there and start talking about life insurance and many, many other things. Well, I do have a lot to cover. Just to let you know who I am, my name is Jorge Baste. I am one of the sales directors for Surebridge Insurance, soon to be United Healthcare Chesapeake Life. We will be changing our name officially in July. We will incorporate both the United Healthcare and United Healthcare name and logo. So that's going to really, really help us out quite a bit. We have been owned by United Healthcare for a number of years now, and we finally are going to be under the same name. So let's go ahead and get started. Um, I'm going to cover a lot today, so I'm going to try to go as quickly, but hopefully not too fast. So our next slide here is our agenda. I'm going to tell you a little bit about who Surebridge is, what our goals are for you, the agents, and our best-selling plans with a brief overview. So the question of who is Surebridge? Well, Surebridge are the supplemental or ancillary or complementary plans, however you want to refer to them as, from the Chesapeake Life Insurance Company. Again, we are owned by United Healthcare. This is our new name. This is what you're gonna be seeing come July. As a matter of fact, we're already marketing the new name with some of our new products. Anyways, what products do we represent? We've got accident, hospital, cancer, heart and stroke, dental, vision, life insurance, and more. Those are the products that we focus on mostly for the individual and family market. What is our goal? Our goal is to add value to you, the agent, and give you the tools to succeed. How do we do that? And I believe that first slide that was up actually touched upon a lot of the stuff that's on this same slide. We provide a vast product line with very rich benefits and competitive premiums. Number two, all of our products are either guarantee issue or simplified issue. On our simplified issue side, it's just medical questions. We will not ask for any medical records. We will not ask for any personal interviews or any prescription drug history. Number three, if you work specifically in the Hispanic market, which I do quite a bit of, This one is very important. We do not require a social security number for any of our plans except our SecureWise plan. Our SecureWise plan is our life insurance policy. It's the only one that requires a social security number. Number four, a number of our products have an issue age up to age 90. And we're going to look at some of those today. So if you work in that over 65 market, whether they qualify for Medicare or not, whether they have a social security number or not, we can insure them. We do offer list bill for employer groups, specifically small employers. If you work with small employers, we do have a solution for them. We have a very quick turnaround on claim payments. We will pay claims and process a claim and get it paid out anywhere between 5 to 7 days. We will pay cash benefits, really a check, but we will pay the benefits directly to the client. Why? We do not coordinate with any hospital, any provider, or any other insurance company. That money goes directly to the client so that client can pay whatever immediate needs they may have, be it medical expenses, rent, mortgage, car payment, whatever it may be. The money is theirs for them to determine and use it the best way possible. We will coordinate with your agency or marketing organization like we're doing right now to do virtual trainings. We will do in-person trainings when possible. Number eight, we do have the backing of United Healthcare, our parent company. Obviously, we will be changing our name soon, so we do have that financial backing. And number nine, and this one's very important, specifically for the agent community, we pay commissions 2 times per week, not 2 times per month, 2 times per week. And our policies, our products, our plans are available 365 days a year. Okay, let's go ahead and continue here. Now, what we look for what I like to call a win-win, win-win situation. What do I mean by that? We want a win for the client. Whenever you meet that client's needs, that client comes out winning. Okay. Number two, we want a win for you, the agent. When you meet the client's need, you as the agent also come out winning because you're either establishing a new relationship, reestablishing a relationship, or strengthening the relationship with that client. And of course, you're going to get paid a commission. A win for the agency or the marketing organization, and lastly, a win for us, for Surebridge. So the idea is all of us working together, we can all meet our goals. So let's take a look at our best-selling product lines, and we're probably going to cover, I think, just about all of these today, okay? Illness policies, we've got our hospital-wise policy, our CI-wise, this is our hospital indemnity, covers a lot more than just hospital, as you'll see. Our CI-wise, this is our critical illness policy, which does encompass both cancer-wise and heart-wise, okay? Our accident policies, there was a recent change here. We have a brand new accident policy. I say brand new, but it has been out for over a month now, which is called Accident Wise. When you take a look at the benefits and the premiums on these, you're going to be very impressed. We're going to take a look at that one as well. In our dental and vision division, we have our PPO dental and Premier Vision. We also have what's called our it's not on here, but it's called our dental, vision, and hearing policy, what's our prime DVH, all in one policy. And lastly, we have our life insurance policy, which is our SecureWise, okay? Our SecureWise policy, I'll just go ahead and tell you right now, that is a term policy. It's a 10-year and 20-year term policy. It has some very interesting features. Two of those which are very important, is it does have a guarantee issue for a guarantee issue spousal rider, and a guarantee issue child rider as well. And it also has what's called our critical conditions accelerated living benefits rider. A long name, but basically that is a rider you can add to the policy for the cover up to $100,000 if there is a critical illness or disease that that client is diagnosed with. We will pay that out without whatever that benefit is, without affecting the face amount. So that's very interesting as well. I don't think we're going to have time to take a look at our underwriting guidelines, but that is found in the agent portal. So let's go ahead and continue. Let's jump right into critical illness. Our critical illness policy, also known as CIYs. Here you go. One of the policies we have with an issue age up to age 90. Benefit amounts anywhere from $5,000 to $100,000 for the 64 and over market. 50,000 is the maximum benefit, and that is per category. And as you'll see on one of these slides, we have 3 different categories, and each one can pay out up to the maximum benefit. GI, we do have a guarantee issue component for $5,000 and $10,000 benefits, and that is for the under 64 market. There's no reduction in benefits. What do I mean by this? If you have a client who is 63 and applies for that max benefit of $100,000, when they turn 64, 65, 66, etc., they can continue with that maximum $100,000 benefit. Why? Because they purchased it prior to age 64. That's what I mean by no reduction in benefits. And we have a 3-category approach, which we'll see in just a second. Here it is. How does the plan work? Okay, we have a couple of steps here. You basically, or your client in this case, you will be proposing this to your client, has to choose a base policy. That base policy can either be CancerWise Plus or HeartWise. Both of those will pay a lump sum benefit depending on what benefit amount that client chooses. 95% of the time, clients will choose CancerWise Plus. Why? Because you can add 2 additional benefits to that policy. For example, as your base policy CancerWise Plus, you can add what is the heart and stroke coverage, as well as the critical conditions coverage. Each one of these for the under 64 market can be up to $100,000, and we will pay in each category. This is not a one and done policy. Okay. Step number 2. Oh, sorry, forgot to mention HeartWise. Now, if you have a client that by chance and unfortunately maybe has had cancer already and may not qualify for the CancerWise policy, you can always do the HeartWise policy as that base policy over here. In that case, you can only add the critical conditions coverage for to that policy. Again, both of those for $100,000 each maximum. And we do have some optional riders, okay, and those riders are additional optional riders, and those are recurrence benefits for both heart attack, stroke, and invasive cancer. We do have a small wellness benefit as well. We have an example right here of how it works. I have highlighted this section. Why? Because it's important that you know your customers can claim maximum benefit payment in each category of coverage, in addition to optional recurrence benefits. Here it is, CancerWise Plus, 100% of the benefit can be paid out, as well as HeartWise, 100% can be paid out. Critical conditions rider, 100% can be paid out. Okay, these are all separate events now. If you have those 2 recurrence riders for invasive cancer and heart attack and stroke, those will pay 50% of the maximum benefit for a total of 400%. That's the maximum this policy can pay out, believe it or not. This is a great example that shows you how we would pay out in every category. We have John, who purchases the full series of coverage from CIYs with a benefit amount of $50,000. This is a bit of a drastic example. It can happen, but it also goes to show that we're going to pay in every single category. He has the CancerWise Plus as his base policy, and he is diagnosed with leukemia in 2018. We paid out 100% of the policy, of the benefit in that category, $50,000. With the lump sum heart and stroke rider, he has a heart attack a year later, 2019. We paid out 100% of the premium. Oh, getting confused there, huh? Of the benefit, $50,000. A year after that, with his critical conditions rider, he has a major organ transplant in 2020. We pay out 100% of that benefit at $50,000. Okay. He does have the recurrence rider for invasive cancer, second diagnosis of cancer, in this case, lung cancer. A year later, 2021, we paid out 50% of that max benefit of 25,000. And lastly, heart attack and stroke recurrence rider. He has his second heart attack in 2022, and we go ahead and pay out 25,000, which is 50% of that maximum benefit, for a total of $200,000. This goes to show that we will pay in every single category. Now let's go ahead and continue. Talk a little bit about our hospital-wise policy. I know I'm going a little bit faster, but we do have a lot to cover. Hospital-wise, again, this is one of those policies that's available up through age 90, issue age up to age 90. Has a wide range of benefit amounts and periods. We do include, as part of the base policy, observation benefit and mental and nervous built in automatically. That is not a rider. You can add 7 riders to this policy, which really helps you to customize it for your client. And we do have what's called our hospital-wise senior plan builder tool. That is within our quoting system. Not sure if you have access to that one in Insure Me Now Direct, but we do have that, meaning that it will see exactly, you just pick whatever Medicare Advantage plan your client has. And if the system determines that the client is over the age of 65 or over, it automatically, once you choose that, gives you exactly what their out-of-pocket costs are with their Medicare Advantage plan and the best solution through hospital-wise. So that is available. Now, our benefits for daily hospital benefit, when you're admitted to your hospital or your client may be admitted to the hospital, they can choose between $50 to $1,000 per day. Benefit periods can range anywhere from 3 to 365 days a year benefit. And of course, as you know already, this is good with an issue age up to age 90. It is renewable for life as long as your client pays their premium. Okay, these are our guarantee issue benefits. Okay, this is what is highlighted in Insure Me Now Direct. The guarantee issue benefits are probably, we've had them out for about 8 months now. And the best thing about it is, here you have your base policy. You have these 7 different riders that can be added to it. If you stay, while you're quoting, that is, if you stay within these thresholds in here, okay, the policy, if your client chooses to go with that quote and enroll, it will be guarantee issued, no medical questions. Okay, your client may be suffering a major illness, may have cancer at the currently, and we will insure them under the guarantee issue policies with a guarantee issue amounts. Okay, one thing that you have to be very clear on, though, if you do go over on any of these, for example, the ambulance rider, say instead of 200 maximum, it was 300 maximum, it automatically goes into simplified issue. There's nothing wrong with simplified issue. We will still accept quite a few people with medical pre-existing conditions, not all medical pre-existing conditions, but some. And if your client needs higher benefit levels, well, this would be the solution. Okay, as you can see, the benefit levels are higher here. But if you want to keep this simple, the guarantee issue, not only will it get issued regardless of medical condition, but it is a time saver. And I say time saver because those of you that work during these open enrollment periods where things just get crazy and you don't have enough time to do anything, this will save you 20 to 30 minutes because you're not going to spend those 20 minutes asking medical questions and taking down medical information. It's guarantee issue. Makes life easier for you and probably for the client as well. It is available. This guarantee issue is available up through age 90. Okay, so keep that in mind. Accident wise, this is our brand new accident policy. Notice that we are already incorporating that United Healthcare logo, and this is our new name, United Healthcare, the Chesapeake Life Insurance Company. So moving forward officially in July, the name Surebridge goes away and it's going to be replaced with this one right here. And of course, we are already taking advantage of that. Let's take a look at some of the highlights of this policy. Eligibility. Accident wise, like most accident policies, is guarantee issue, no medical questions. Okay. What I really like about this is that we can now do it up through age 75, age 75 in just about every single state that we work in, except California. There it is up to age 64. So you can do it up to age 75 if you have clients in that category, and there is no termination age. When that client turns 80, 85, and keeps paying their premium, we will keep insuring them. We will not terminate the policy because they have reached a certain age. Number two, child primaries are allowed. This is allowed on our accident policy, our dental, our vision, and our hospital-wise policy. What does that mean? That parents or guardians do not have to apply with their children. If they have kids that just do a lot of sports and just want to do a policy for their children, they can do so without them having to be on the policy. So that is a big selling feature. Benefit options, here we go. We've got option 1 through 4. And what you're going to see, of course, option 1 will be the one with, it still has fantastic benefits, but it will be the most economical option. And you're going to see those rates on the next slide. Option 4, of course, will be the best option. So hospital confinement, if you are hospitalized due to an accident, if you have option 1, you're going to get paid one time per year now. This is a client, one time per year if you're hospitalized, admitted to the hospital, $10,000 to $20,000, depending on which option you choose. Emergency room treatment, we will cover that up to 4 times per year, anywhere from $1,000 to $2,000, of course, due to an accident. Urgent care, we do cover the urgent care center. Urgent care facility up to 4 times per year as well, anywhere from $200 to $400 per injury. Major diagnostic exam, we're going to cover 1 per year if your client needs an MRI or CT scan or something to that nature due to an accident. That's going to be $1,000 to $2,000 per year. Follow-up treatment or physical therapy, you get up to 5 visits per year between both of those, and that's going to range anywhere from $100 to $200 per visit. And these two are relatively new. It was not included in our previous accident companion policy. Okay. Outpatient surgeries, we will now cover outpatient surgery due to an accident, anywhere from $1,000 to $2,000. And we've got an AD&D benefit here, accidental loss of life, limb, or sight. And that's going to be anywhere from $10,000 to $20,000, depending on what option you take. Best part are the rates. Okay, this is a sample I ran in our quoting platform. And what you're going to see here is that you've got, and this I ran in the state of Florida. However, the difference in premium in other states is literally cents. Okay. So here you go, $15.18 per month with option 1. Okay. I ran it on a 40-year-old male. The truth is that whether your client is 18 years old or 75 years old, it's exactly the same premium. Does not make a difference. Okay. Premium is not based on age. So that's option 1. This is one of our best selling options. It's at $15.18 per month. Option 2 is a little bit better in benefit, $21.02 per month. Option 3 is our second best selling option, and that's just under $28 per month. And of course, option 4, our best option benefit-wise, will be 43.42 per month. Let's go ahead and continue and let you know that what we did with this new Accident Wise plan, for those of you that have worked with us before, we basically took the best of all of our plans here and condensed it as best as we could into Accident Wise. So we are sunsetting these plans here: Accident Companion, Accident Direct, Protected Plus, and Critical Accident Direct. Now, if your clients, if you have current clients, such as myself, for example, I've got Accident Companion for myself, even though I get supplemental coverage through United Healthcare. I decided, you know what, I really believe in what we sell. I'm going to get some additional supplemental coverage for myself and my family. So I'm going to continue my Accident Companion plan, and all I have to do is just keep paying my premium. So any client that has any of these options in place now can continue them. Any new clients, it will be Accident Wise. Okay. So that is our new accident policy. Now, this one, again, is not available yet on the Insure Me Now Direct platform, but it can be quoted through your Surebridge agent portal. Okay, keep that in mind. Quoted and enrolled, of course. PPO dental, I'm going to start moving on a little quick here because we don't have a ton of time left here. But our PPO dental, again, we have a policy that does encompass the over 65 market, okay, for issue ages. We have the non-senior issue ages up to age 65 and the senior ages literally up to age 99. We normally don't get anyone at that 99 age group, but it will go up well past age 65, as you can see there. As far as benefits, they are identical in both age categories. The only difference is that your clients who are seniors that enroll on this plan will probably pay about $4 or $5 more per month. That's it. Benefits are identical. Again, child primaries are allowed. You can have that child only policy. Parents do not have to apply with their children. Right now, we're using the Carrington Network. That is a PPO dental national network. Okay, it is a PPO plan, so your clients will get in-network and out-of-network benefits. Come June, we will have, and I don't have the information on this yet, but we will have a new dental plan coming out. When that dental plan comes out, of course, it'll be marketed under our new name, but it'll also utilize the United Healthcare National Dental PPO network. So that change is coming. Currently, we're still with Carrington. We offer a basic and premier plans, as you'll see on the next slide, and preventive services are covered from day one at 100% zero cost to the client. PPO dental, we have the two options, basic and premier type of coverages. Type 1 is going to be preventive and diagnostic benefits. Type 2 is usually your basic services. And type 3 is going to be your major services. What you're going to see is that on both basic and premier, we're going to cover 100%. Type 1, no waiting period, no deductible. Okay, type 2, basic services. On the basic plan, we're going to cover 50%. On the premier, 80%. There is a 6-month waiting period in both cases. Okay, type 3. Notice that the basic plan does not cover it. Okay. However, this basic plan, take a look at the premium. Your premium is $19. So it's a very competitive premium. If you have clients that say, hey, listen, I just need to go in for my 2 checkups, 2 cleanings, a couple x-rays, and maybe the occasional cavity and filling or whatever the case may be, this is a good option for them, the basic. If you have clients that need more coverage, then obviously the Premier is the answer. On the Premier plan, Type 3 major services are covered at 60% after a 12-month waiting period. One thing I will say about the waiting periods on the Premier option and the Premier option only, if your client has had previous PPO dental coverage with another carrier, be it through his or her employer or on an individual basis, and has had it for at least 12 months prior to applying to to our policy without a gap greater than 63 days to be exact, we will waive all the waiting periods, meaning that that client will have coverage for every single type of service from day one. Okay, but they have to meet that prerequisite first. Okay, calendar year deductible $100 per person on the basic, 50 on the premier. Calendar year maximum is $1,000 per person on the basic, 1,200 on the premier. In the state of Florida, this is actually higher. This is actually 1,200 per person on the basic and $1,500 on the premier. So you've got those clients in Florida, they have better coverage. Okay, these are the average rates nationally. Rates may vary by states, and some states are a little bit more, some states a little bit less. Let's go ahead and continue. Our Premier Vision plan, I know this says 0 to 63, but Premier Vision is also available up through age 90. Okay, issue age up to age 90. It's about everything we've looked at today goes to age 90. Eye exams, 100% coverage with no copay if you stay in network. For non-provider, if you go out of network, it will be the same. I'm sorry, it would be 100% up to $30 with no copay. Okay, the network that we use is iMed. iMed is our vision network for this program. Corrective spectacles, standard uncoated plastic lenses with a $10 copay, 100%. If you go out of network, well, it's going to be a little bit different. You'll see single vision goes up to $35, bifocals 55, and trifocals up to 90. Frames, $10 copay with a $120 allowance or discount. Okay, and it is a little bit less out of network, $60 allowance. Corrective contact lenses, $10 copay, again, $120 allowance. Out of network, it is the same, $120 allowance. We do have some additional savings and discounts through iMed. Again, that is our iMed Vision Care is our vision network, okay, that we use. It is a national network, works just like a PPO as well. Frames, you're going to get 20% off the balance over $120. Example, those frames cost $300. You're getting an allowance of $120. Now they're $180. From that $180, we're going to take another 20% off. Okay, or iMed is actually going to take another 20% off. So it's a pretty good deal. Contact lenses, same concept, except it's 15%. Additional pairs benefit if you're getting that second pair of eyeglasses, you've already used up all your benefits. They're going to give you a 40% discount. If you're getting a second pair of contact lenses, you're going to get a 15% discount. Lens options, as you can see here, we do have standard polycarbonate $40 coverage, PRS scratch coat $15, tints $15, standard UV coating $15, standard anti-reflective $45, and other lens options 20% off retail. Non-scheduled items 20% off retail. If your clients need vision correction surgery, such as LASIK, they're going to get a 15% discount off retail or 5% off a promotional price. Best thing about this policy is the premium, $9 per month. This is for the under 64 market. If your clients are 65 and over or 64 and over, the difference is instead of $9, this is going to be $10. That's it. Okay, $1 difference. But look at the family rate. $25. If your family or that client's family has one child, two children, three, four, five, does not matter. It's $25 per family. Okay, that is very, very attractive, specifically with the larger families, states like Utah, for example. Okay, let's go ahead and continue and look very quickly at our Prime DVH plan. This is dental, vision, and hearing all in one policy. Again, issue ages up through age 90. Okay, another plan that we have up to age 90. We have 100% coverage for routine dental, vision, and hearing exams with no waiting period. You can visit any provider. This really applies to the dental portion of the coverage. We do use the Carrington network once again. So if you stay within network, your benefits are greater, just like they are on a PPO dental. Coverage is available for the whole family. Premiums usually start at about $21. Policies guaranteed, issue, and renewable for life as long as your client pays their premium. Here is a summary of how it works. Combined annual benefits can be anywhere from $1,000 to $2,000 for all three services. As far as dental, we're going to cover type 1 preventive, type 2 basic, and type 3 major. On the preventive, 100% coverage, no waiting period. Okay, simple. That's usually your exams, your cleanings, your checkups, etc. For basic services, type 2, look at this, no waiting period. So that's a pretty nice feature we have there. And the way it works is every year your client has coverage, their coverage is going to increase, right? So year one, we're going to cover 60%, year two, 70%, year three and beyond, 80%. The longer your client has a policy in place, the better the coverage. We follow that same concept with the major services right here, except major will have the 9-month waiting period. That's the only waiting period applied on the dental portion of this coverage. As far as vision, the vision does have on this policy does have a limited benefit. My suggestion is that if your clients need more comprehensive vision coverage, sell them the Vision Premier plan as a standalone alongside with a PPO Dental Premier, okay? Because it will have definitely more comprehensive coverage for vision. If they don't need a ton of vision coverage, this is a great option because the maximum benefit is $200 per year, okay? And we will cover eye exams 100% with no waiting period. As far as materials, there is a 9-month waiting period, and we do incorporate that scaling up of benefits through the years. Year one, 60% we're going to cover. Year two, 70. Year three and beyond, 80%. Okay. As far as hearing, we do use a true hearing network. And the advantage to that is you will get some major discounts up to 50% on hearing aids. Okay. Hearing aids, as you probably will know, can be very expensive. So the maximum hearing benefit is $500 per insured every 2 years. Hearing examinations are covered 100% up to $75 per insured. There is no waiting period for that. And then hearing aids. There is a 9-month waiting period for hearing aids and hearing aid repairs. Okay. After the first year, we're going to cover 60%. Year two, 70. Year three and beyond, 80%. Okay, I have rushed pretty much through these benefits, wanted to cover as much as possible. I don't think I have anything else left as far as benefits go, but I will tell you, you guys, if you're currently contracted with Surebridge, then you probably, or you should have access to your agent portal. Your agent portal, our agent portal and subsportal.com are exactly the same. This is what we call our agent portal. It's short for supplemental portal, okay? So the subs portal is your agent portal, okay? So this is the website or the link for the agent portal. I'm not going to go specifically into the point of sale because most of your sales are going to be done directly through Insure Me Now Direct. With that, here's a consumer website, okay, or the client website. One more time, if you want to jot that down, www.uhcmemberhub.com. Thank you very much. My name is Jorge Baste. I am one of the sales directors, specifically for the Hispanic Latino market with Surebridge United Healthcare. I will now go ahead and turn this back over to Bill.
Yep.
I don't
Thank
know
you,
if you
Jorge.
guys, absolutely. Not sure if we have time for questions. I think we're right at our time limit, so I
Yeah,
think I
what
made it.
we're going to do, we have an open Q&A panel here. So we have questions that came in. We're going to get to every single agent as soon as we end the call in a few minutes. But I also want to mention that if you have any groups, multiple agents, or a personal one-on-one training you want to set up with Levinson, we can grab Jorge and we can organize that
Sure.
for you, virtual or live. So just keep that on the back burner because we're also going to send this to all of our agents over the weekend. So if you hear this live, great. Or if you hear this a week later, just reach out to our marketing department and we can arrange that. Jorge, great work. I have a few more
Thank you.
slides I'm going to touch on, and
Sure.
we'll get everybody out of here in just about 3 to 4 minutes, and we'll do our giveaway and question of the day in just a second here. Okay, so all of these great benefits, products, great technology, instant issue, guaranteed issue, bundling, it's all awesome, right? The free scholarship on top of it. Especially starting at a few bucks a month, it's such a great door opener. And I know Jorge mentioned the referrals. I mean, it's all huge. And this package is really a no-brainer for agents that are trying to create traffic and generate leads. So to get started, make sure you go to our contracting portal and just click on Surebridge and then Insure Me Now Direct, and we'll get you up and running, or reach out to anyone on our marketing team. So the next slide, real fast, I'm going to go very, very quickly. So just jot down any notes, and then, like I said, just send us an email or call into our marketing department, and we'll get every single question answered or concern. Okay, so real fast, Surebridge UHC is part of Insure Me Now Direct, and we also have, and this is huge, you know about guaranteed issue Gerber. You're familiar with Assurities for new products that are on the platform now. We also have Hero, up to $2 million of term life, and then Banner Life. We're working on the programming now. That is the largest term insurance carrier in the world, which will be on Insure Me Now Direct. So we are super excited. The next slide is, I just wanted to draw this up and show everyone the facts, what's going on out there, right, in the life insurance marketing world. So you're seeing a bunch of these new direct-to-consumer sites that are popping up from carriers, IMOs, all the above. To this day, okay, Levinson and Associates has the exclusive rights, okay, with Surebridge UHC. We're the only IMO that has 100% direct-to-consumer platform where you, the agent, are 100% agent of record, and these are your clients. It's not a referral fee, and the platform is free for you and your consumer, okay, plus all of the added benefits that come with it. But you can just check out the checks and the X's on the right-hand side there, Insure Me Now Direct, and then the others, right? So, I mean, it's not even close, especially when you talk about referral fees. They want you to send your clients to this IMO or agency so they can build their book with your clients, which is absolutely crazy. Okay, so do not fall for any of that. Don't pay for a monthly maintenance fee for a platform that's similar, especially if they only have one carrier, which I know they do, because there's nothing that exists like Insure Me Now Direct. Let's keep moving along. So if you're on the life, annuity, health side, it doesn't matter. The point is you have to get the word out, right? You need some kind of follow-up system on autopilot, which is where Ringy comes in. We have the only 55% off discount that Ringy offers to agents. Okay, the only pricing platform like this is with Levinson, partnered through Ringy. Okay, we have a bunch of trainings if you want to get started, or just set up the 2-week free trial, and you can just dip your toe in the water and see if you want to move forward or not. But this is a no-brainer. I mean, we use it now for agents, and it's about 20 to 30% on the average where you're going to turn prospects into new clients, period. Next up is the Co-Branding Resource Center. This is available on our new website, and everything you're looking at is co-brandable. We handle this in-house at no charge, so you can check that out when you can. The next slide is, I promised you every week I was going to pull up the top performing social media posts that have to do with the topic that we are featuring that week. So this time I pulled up the top performing posts for critical illness. So I think this is very interesting. And like I said, just change a few spokes in the wheel. But this is a great example. So real fast, 1 in 4 men and 1 in 5 women in the UK will be affected by a serious critical illness before retirement age. Obviously, very similar stats in the US, but again, just an example, right? On the right-hand side, protects income during an unexpected illness or injury. And then they did like a 4-page spread that I thought was interesting as well. Next up is claim reason. So this is interesting too, because Keep in mind, these are posts from carriers. If we, there you go, perfect. From carriers and from agencies. So on the left side, they're just showing statistics, the percentage of people that are diagnosed positive with cancer compared to other illnesses. So I thought that was good. Again, just raises the eyebrow, sparks conversation. Right hand side, critical illness insurance, tax free, medical support, further aid. Basically, click here. And these are all very, very simple. This was my favorite, the next one. This, again, was one of those sliders where it's 4 different posts for critical illness. So this is an agent here from Canada. Imagine a family where the breadwinner is suddenly diagnosed with cancer, requires extensive treatment. And then if you scroll on the right side, critical illness is the solution. And again, all this is meant to do. This one created about 11 comments and over 100 likes. All you're supposed to do as the agent, you go back to those people that commented to say, hey, when can we talk, through a direct message or personal message? And it sets up your new client, and it's free. So you have to be scrappy. You got to be creative in today's world, right? Everybody's out there trying to do the same thing. So I love these door openers because most agents don't have the access to these products. The podcast is on the left-hand side. So real fast, we have Brashard Perryman, who from the Tampa Bay Buccaneers, who caught Tom Brady's 400th touchdown pass. That's an awesome one that we're about to launch. And then just below that, we have the Hill Financial Group interview that's coming up in the next couple of weeks. We'll be launching that as well, where I pick their brain for an hour and talk about sales ideas, what they're doing that works, what doesn't work. So it's a great learning tool for you. Upcoming trainings is what we're looking at right now. On the bottom in the blue section is our new IUL presentation sales software system, speaking about the new AG 49 ruling and updates. So very important, especially if you're in the IUL space, on the 18th. Then on the bottom there, we're featuring our own marketing department with Beth, and we're going to jump into marketing in a box, basically a 100-foot overview on how you need to be marketing in 2023 by leveraging our resources, which, by the way, most of them are free for you. Last slide, question of the day. I hope you were paying attention. I hope your little fingers are on the keyboard, because you have to answer first and correctly to win. But first, left-hand side, I'm going to talk about my Positive Tuesday quote, which is all about being results driven. Don't just talk, say, and promise. Act, show, and prove. Okay, words are cheap. We all know that. Action plan is what's important. Name of the game, question of the day. I'm going to say it right now, so get ready. I spoke about a statistic in the earlier slides. In 2022, how many people were diagnosed with cancer in the United States of America? You tell me the number, and you win. Apple AirPods, the Relentless Tim Grover, New York Times best-selling book. You win both if you answer correctly. And by the way, everybody's a winner, because if you go to our Facebook page or leave a Google review, I'll send you your choice, the Relentless book or the IUL prospecting book, as long as you're active with Levinson. So Andrew's going to take a look to see who answered first and correctly. Do we have the winner, Andrew?
Yes, we do. It's Richard G. Richard G.
Richard G. The answer was 1.9 million people in the U.S. were diagnosed with cancer. Sorry about the time delay here. Thank you for hanging in there with us. I hope this was beneficial. Let's have a wonderful rest of the week, a great weekend, great selling, and please reach out anytime for anything you need that will change your business for the better. Thanks, and have a great day.